Your blood pressure reading could be completely wrong, not because your machine is faulty, but because of how you're checking it. Now, this mistake alone could make your blood pressure look dangerously high or falsely normal. Let me show you how to check it properly, the way we recommend here in the UK. High blood pressure, also known as hypertension, is often called the silent killer because most people feel completely fine. But over time, it can quietly increase your risk of stroke, heart attack, kidney disease, and even dementia. And here's the problem: if your readings at home are inaccurate, you could be misdiagnosed, overtreated, or worse, miss a serious problem altogether. In the next few minutes, I'll show you the exact way to measure your blood pressure at home, the common mistakes that make readings unreliable, and what numbers actually mean based on UK guidance. Stay with me because one small mistake could completely change your results. If you're checking your blood pressure at home, the first step is making sure that you're using the right device. The best option is an upper arm blood pressure monitor. Wrist and finger monitors might seem convenient, but they are often less accurate, especially if not positioned perfectly. In the UK, we recommend using a validated monitor, one that has been tested for accuracy. The cuff size matters as well. This is something many people do not realize. If the cuff is too small, your reading can appear falsely high, and if it's too large, it can appear falsely low. So always check that the cuff fits your arm properly, not too tight and not too loose. Most standard cuffs are designed for average arm sizes, but larger or smaller cuffs may be needed if required. Adequate preparation is important. Before you even press the button, what you do beforehand can significantly affect your reading. Try avoid this for at least 30 minutes before taking the measurements. Caffeine, smoking, and exercise. This can temporarily raise your blood pressure. Now, this one surprises people. Having a full bladder can increase your reading. It's important to sit quietly for about 5 minutes before measuring. No talking, no scrolling on your phone, just rest. Now let's talk about positioning. This is where most people get it wrong. Correct positioning includes sitting quietly with your back supported on a chair. Keep your feet flat on the floor. Do not cross your legs. Rest your arm on a table at heart level. If your arm is hanging down, your reading may be falsely high. And if your arm is too high, it may be falsely low. So always aim for your arm to be at the same level as your heart. This is key. Also, it's important not to talk whilst taking the measurements. Stay quiet and stay relaxed. In the UK, we usually advise taking 2 readings, leaving 1 minute between these 2 readings, and doing this morning and in the evening for about 7 days. Then we use the average, usually excluding the first reading. Why is this important? This is because blood pressure naturally fluctuates throughout the day, so one reading doesn't tell the full story. Now, let's talk about what your numbers actually mean. According to the NICE guidance, a home blood pressure reading of 135 over 85 or higher is generally considered high. This is slightly lower than clinic readings because readings at home are usually more relaxed and therefore are expected to be lower. If your blood pressure is very high, especially 180 over 120 or above, this could be a medical emergency, especially if you have symptoms like chest pain, severe headache, vision problems, shortness of breath. Then you need to seek emergency medical attention. Here are some common mistakes that people make. Let's go over this quickly. Firstly, talking during measurements, sitting incorrectly, arm level not being at the same level as the heart, not resting before checking, using the wrong cuff size, and relying on a single reading. Any one of these can significantly affect your results. Checking your blood pressure at home is one of the most powerful things you can do for your health, but only if you do it correctly. Have you been making any of these mistakes? Let me know in the comments below. And kindly save this video so you can refer back to it anytime you want to check your blood pressure. And if you want clear evidence-based health information like this, subscribe for more. Thanks for watching.